Hello everyone. My name is Amanda. Um, I am recording this video because I had a double jaw surgery in, when was it? Late October, early November, a year and a half ago. I actually had two. I had my first one in late October, and then 2 weeks after, when I was recovering, I went back to the doctors, and they were checking things, and they saw my jaw wasn't moving properly, and basically they said, we're gonna have to do a second surgery. So I actually had two. But I haven't recorded any of my journey. I know there are several, or a couple other YouTubers who have recorded their journeys. It's a relatively new surgery, in like the scale of how long usual surgeries have been around. This is a relatively new surgery in the surgery field. I searched around for a long time. Do your homework. I searched around for a long time for somebody, a doctor that I trusted, that was in network. And I talked to somebody else who I just happened to know, also had the procedure done, and got some advice. There are some really good, like I said before, there are some really good YouTubers out there who are sharing their experience and giving advice on how to deal with the surgeries. I want to throw my hat in the ring for long-term post-surgery. I have had feeling coming back. My doctors have said that usually whatever feeling is back after about a year, that's what you're going to be with for your whole life. And a different surgeon than the one that did my surgery. I had my surgery done at Stanford Hospital, but a surgeon that I had been talking to in New York City, who also does this surgery, said that about 5% of patients do have some numbness, that like a spot that's cold or a spot that's numb for the rest of their life, which was one of the major reasons I was nervous to get the surgery, other than the fact that it's a surgery, and that's kind of nerve-wracking in the just to begin with. Anyways, the reason I'm chewing gum, I apologize for, because I'm doing a video. I apologize. It might be a little bit annoying, but it actually has to do with the point I'm going to make, which was that I've had feeling coming back. It comes back, at least for me, in my body, and I'm not a doctor, so I don't know if this is, typical, but for me, it comes back in like shooting pains, very sharp pains that are like in certain areas, last about, I want to say like up to 30 seconds. But I had most of those, like in the first month, I want to say, after my surgery. And there are parts of my face, especially my chin, right here, both of these places on either side of I guess what would be the chin that comes out, which I do not have. That would have been a cosmetic surgery to get that added. But either side has been feeling numb, or not feeling. And I've also had very severe dryness on my lower lip, and a lot of numbness / tingling, especially when I push. Right here, it tingled, mostly like on the corners of my bottom lip. And I also had a spot right here that I can still feel does tingle. It kind of moves sometimes. Moves where it tingles. I'm chewing gum because I've been going to an acupuncturist. First time I've ever really gone to an acupuncturist. I thought I had seen some videos from Kitten Lady on YouTube of when she was taking care of some paralyzed kittens, and she went to an acupuncturist, and in addition, the acupuncturist ran some small electrical currents between some of the needles, and it was helping with the mobility a little bit. It didn't help completely for that particular kitten, but I was kind of curious about if that would help me regain some feeling. And long story short, I really want to encourage people, you know, I'm not a doctor, so I'm not gonna be able to like prescribe like if by a year you aren't feeling, there are still some like spots that you don't have feeling in, or maybe like before a year, I don't know, but I would like to encourage people to go to acupuncture, and also have electrical current, request electrical current therapy. Not sure what it's called. Like I said, it's my first time going, but my acupuncturist also told me to chew gum, just so that I would increase circulation in the area, because that is my mouth, or my exterior mouth, chin region that is a problem area right now. I just came back from my first acupuncture appointment where I requested she use electric current, and it is incredible. Like I am moving my mouth in ways that I wasn't able to move it since before surgery. There are some parts of my chin where I can feel. Wow, I'm just touching it right now. I'm getting some feeling back. So I want to encourage everybody who might be in that 5% or whatever percentage it is, who, you know, even after a long time after surgery, doesn't have full feeling, maybe has some some tingling. Tingling is actually a step above numbness in the healing process. So especially if you have tingling, that could be a good sign if you go to the right acupuncturist, that you might be able to regain some feeling. But yeah, this was incredible. I was talking to her, my acupuncturist, after the session and scheduling the next session, and I was saying words, especially W words and Y words, just making those shapes with my mouth, like yeah and wha. I feel like my mouth can move so much more after that session. And it was a very sudden change. I want to say that this is only my first time using electric current in acupuncture, so I'm not sure how long it's going to last or if it's going to have me make a full recovery, but just wanted to put that out there. You know, double jaw surgery is a very, well, I would say it's a serious commitment to go through, especially the whatever time away from work or school you have to take, but mostly, you know, the recovery process where you are on liquid diet for a long time afterwards, and that is a lot to go through. But you know, just in general, because just wanted to say general things about my experience, because I haven't been documenting my journey like some other YouTubers have. But acupuncture, super interesting. A real possibility that could help. A lot of acupuncture increases blood flow to certain areas, and there are certain acupuncture or acupressure points where an acupuncturist will stick a very small needle based on you know, what symptoms you have. They will go for different acupressure points. I don't want to say too much about this because I am not really well read with the history and you know, the practice of acupuncture, but it seems like it's a very good option for people who have paresthesia after double jaw surgery. After a while, do not, I repeat, do not, you know, if you have common sense, you probably have realized this already, but I will spell it out. Do not do acupuncture while you are bedridden after surgery, while you still have your ice packs on your head, while you absolutely can't feel anything. Don't do it while you're still healing. Do not do it when your face is completely numb, you know, when you're like in and out of sleep because you are so exhausted, your body is healing bones. You know, I would wait until you feel relatively normal until you do anything like that. Yeah. Like I said, I'm not a doctor. So I'm not going to be able to prescribe a certain like time frame when you can do it after surgery. I am a year and a half out of surgery. I had 2 surgeries, so my symptoms could be compounded. I'm not sure. But look into it. It's a real option, and you will get through it. Your surgery, if you're considering doing it, and you have the time and money, and like all other things equal, I would do it. I would seriously do it. Be prepared to how do I put that? Go through an ordeal after your surgery. I don't want to, for me at least, I didn't want to think about the particulars of my surgery. I didn't want to think about how much pain I was going to be in afterwards. I just knew that I wanted to have the surgery for cosmetic reasons. The doctors were doing it for anatomical and medical reasons. I was thinking of it as more of a cosmetic reason, because my teeth shifted back after years and years of braces, and I just wanted straight teeth finally. Yeah, so I knew that I wanted it for a cosmetic reason, and I wanted it, like, I know that I have a relatively high pain tolerance. But knowing things in advance would have freaked me out a little bit more. So I just went in there and I was like, I've dealt with painful things before. I can deal with whatever it is, as long as, surgery's been around for a little while. Maybe not a lot, but people have gone through this before. Doctors are going to be taking care of me. It's not going to be like dangerous kind of thing. I'm just going to be in some pain. Yeah, I didn't want to know particulars, but I'm glad I did it. And I am very happy and really hoping that this helps some people who are recovering from surgery, long-term recovery of like specific areas that might not be fully recovered. Yeah, so hopefully this helps some people, and stay tuned for more. I'm not sure if I will be posting more right now, but let me know if this helps you out. And I hope you have a great surgery journey, whatever that means to you. Okay.